There's a reason why endoscopic brow lift and an upper lid blepharoplasty in combination have become more and more popular, especially patients in their 20s to 40s. Because patients are opting for a more natural, undetectable enhancement instead of these dramatic changes.
Hi, I'm Dr. Christopher Zumalin, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
In today's video, I'm going to go through everything regarding my signature bellow lift, which is a combination procedure that I've developed, which includes an endoscopic brow lift to naturally improve the low-set brows to a more appropriate shape and height, upper lid blepharoplasty to rejuvenate the aging and sagging excess upper eyelid skin, and lower lid blepharoplasty, where rejuvenation of the lower lid is possible by improving the excess fat pockets, the lower lid hollowing through a combination of blepharoplasty with fat repositioning in the lower eyelid. The combination of these three techniques, the endoscopic brow lift, the upper lid blepharoplasty, the lower lid blepharoplasty through my signature techniques, all together comprise an upper facelift, which comes to be my signature bellow lift. The upper face is usually the first telltale sign of aging in someone's face. This happens through structural changes that we discussed before, volume loss, and also skin texture changes. These three things create aging in the brow. It's the first area where we see the brows descending with time. Loss of volume, number one. Two, skin texture changes cause these brows to come down more so laterally than they were in the past. And patients report that their eyes feel more heavy, their forehead feels more heavy as well. They're always constantly raising their forehead to see better. That's brow ptosis. Second thing is excess skin, which occurs usually in the upper eyelids with or without brow ptosis. Usually in my practice, and when I see patients, most of them have a combination of both brow ptosis and excess skin, both presenting. In the past, more and more surgeons would recommend an upper eyelid blepharoplasty, even in those patients that needed a brow lift. Now, with time, patients are able to see more before and afters. Patients are able now to be more educated. Patients are more aware about other options. The modern patient is educated. At their disposal, they have the ability to go online, to research, to see before and afters. I see this in my practice as patients now are becoming more and more aware of what an upper facelift can provide for them. What are the advantages of a brow lift and in combination with an upper blepharoplasty? It's something that I'm seeing more and more with over the past several years, and it's exciting because patients are now aware of this ability to address eyelid aging, not just by removing upper lid excess skin, but also rejuvenating the brows at the same time. There's a lot of benefits to having the brow lift done in combination with an upper eyelid blepharoplasty. First and foremost, you're restoring aging changes. So if there is an aging change that's occurred in the brows, which causes the brows to come down, that should be addressed by the doctor. That should be addressed by the surgeon. So when patients come and see me, they are usually complaining of aging around their eye area. They're not exactly sure if they need a brow lift. They're not exactly sure if they need upper lid blepharoplasty. So it's my job to educate my patients and to show them how their eyes and brows would look with both procedures done together or one of each. And that's the beauty of an in-person consultation. So for a long period of time, patients often address their lower face for rejuvenation, which obviously occurs with aging as well, but oftentimes the upper face was missed or disregarded. In my practice, obviously I specialize in the upper face area, and I see that that is usually the first telltale signs of aging, often even before the lower face becomes an issue. So it's really important to identify that area, and these patients can undergo an amazing rejuvenation. Just as procedures such as my signature bellow lift are getting more and more attention now, it's because they're able to address these areas that are often seen as the first signs of aging in the face. We're going to talk about why this procedure is becoming more and more popular, especially in my practice, why patients are coming in and asking for the signature bellow lift, because they are able to recognize the importance of rejuvenating a combination of not just the upper eyelids, but the brows, the upper eyelids and the lower eyelids to get this comprehensive rejuvenation of the entire upper face. It's less invasive than a facelift. The incisions are small. They're 5 small incisions that we make behind the hairline to gently release the adhesions or the tissues that essentially keep the brow the way they are. So the brow lift uses these incisions to allow for me to use a very small camera to go in and release the periosteum or this thick tissue that adheres the brow to the underlying bone. So I'm essentially gently peeling off this tissue through these small incisions, gently elevating the eyebrows, placing some sutures here and here to kind of position the brows while they heal, and then gently close up. No need for cutting hair out of the way. Everything is done in a very beautiful fashion. At the end of the surgery, we actually wash the hair, wrap up the patient's hair in a nice little head wrap for 24 hours. It's beautiful, it's very minimally invasive, and allows for patients to really have this beautiful improvement through these small incisions. Also, it doesn't create this pulled look, right? I mean, initially, the patients will obviously have slightly overcorrected brow position, but with time, the brows do come down over the first couple of weeks. It's expected. That's why it's always important to overcorrect by a couple of millimeters. And I always tell my patients, it's important to know that they will come down a little bit, but ultimately, this is not a surgery that creates a very aggressive pulled look. And most of my patients don't come in for that. So that's why they come in and see me, because they understand that this work that we provide here is done in a very natural fashion. And ultimately, the benefits of the signature bellow lift are that once all is said and done and you've healed, the results are undetectable. You're unable to see the incisions. Everything is hidden. And so the beauty of this is that these incisions are well placed in areas that are not visible. And when we perform an upper lid blepharoplasty, the incisions are carefully created within your natural crease, which you already have a wrinkle present. So we're making that incision exactly through that crease, using a very fine incision and closing that incision with very fine, meticulous closure of sutures. And then the post-operative management, which involves post-operative care, also is really important. We really optimize post-operative care with use of skin-to scar cream and other modalities to really improve the incisions so that they're virtually undetectable once all is said and done in a few months. So many well-known figures are opting for subtle, high-quality enhancements instead of these drastic changes. And the bellow lift fits right into this trend of invisible work. My bellow lift is typically performed under general anesthesia. It's not a procedure that I perform under local anesthesia. Procedure that can be quite uncomfortable when the patients are awake, and I want my patients to have the best experiences possible. Now, if my patients were just undergoing an upper eyelid blepharoplasty, that can be done under local anesthesia here in my very own office. But the bellow lift involves utilizing these small incisions and doing some dissections through these small little incisions with a camera, and I need the patients to be as comfortable as possible. So we ensure that our patients have the best experiences possible. We're using a board-certified anesthesiologist in our state-of-the-art surgery center, where we have the best care possibly imaginable when it comes to such procedures that I perform. When it comes to recovery time for my signature bellow lift, generally patients are able to resume most activities by 2 weeks. We ensure rapid recovery techniques to make it possible for patients to get back to work, usually within 1 week. Now, in terms of work within 1 week, you can start to do light work within 1 week, but we'd say by 2 weeks, you'd be able to see family and friends, go out to weddings, events. By that time, you're still gonna have a little bit of bruising and swelling at 2 weeks, but I like to say, generally speaking, 80% of your bruising and swelling gets better by 2 weeks. Now, everybody's different. Some may accelerate much quicker than others. My job is to make sure that you're healing on the right path, that you're healing on your path, and that I'm providing everything possible to make sure you heal as well as possible. So things that we do to ensure that you heal as best as possible is optimizing your medical condition. If you have high blood pressure, a lot of my patients have mild high blood pressure, some have a little bit more than others. So it's important to make sure the blood pressure is controlled as much as possible. We'll ask you to touch base with your doctor, check blood pressure recordings at home. If your blood pressure tends to run a little bit on the higher side, it doesn't mean you're gonna have a bad outcome. It just means that you're probably more prone for bruising and delayed healing. So it's important to optimize your blood pressure and control it. 2 is avoiding smoking before surgery. I don't see too many patients these days smoking, which is great because more and more patients are aware of their health and the benefits of not smoking, but some still do, and it's important for them to stop before surgery. Smoking delays healing, smoking is inflammatory, it affects your lungs during anesthesia, so that is something that we need to quit before surgery and afterward. Diet, important to eat great before, during, and after surgery. We have a list of dietary supplements and food that we recommend. Colored fruits, oranges, strawberries, berries, blueberries, kiwis, pineapples. Fantastic when it comes to healing with their antioxidant properties. Vegetables rich in fiber, leafy vegetables, beans, fantastic. And lean meat, such as chicken, protein, fish, fantastic when it comes to meat, the protein that you can eat in the recovery period. So these are items that we recommend for patients from a food standpoint. Arnica, we do recommend arnica for patients. Skin of a Bruise is a product I've developed as a need for the highest pharmaceutical grade arnica that we can provide our patients before, during, and after surgery. This product is amazing. It's really helped improve my patients' recovery from a swelling, discomfort, and bruising standpoint. Not only does it have arnica, homeopathic arnica, but it has bromelain, it has grapeseed extract, it has zinc, it has vitamin C, and it has rutin. All of these ingredients are antioxidants. They help in the recovery, and this is something that we provide all our patients starting about a day or two before surgery for about a week. Also, it's important to, in recovery period, to have somebody be with you, to take you home, stay with you for at least 24 hours after the surgery to make sure that you are comfortable, that somebody can assist you to the bathroom, somebody can provide medications for you, somebody can be available to pick up the phone when my nursing staff calls and connects with you to make sure you're doing great. My team is very involved with our patients. So what that means is we're with you during every step of the way. From before surgery, we go over the pre-op planning with you. I'll meet with you as well before surgery to go over the plan one more time. And after surgery, where my team will be in touch with you and or your family member or nursing team member that's taking care of you, and over the next couple of weeks to make sure you're doing everything correctly. There are always some questions you may have. We are constantly available, and I think that has really helped excel our ability to give the best results possible for patients, because there's not a lot of questions that patients have at the end of this experience, because we're always going with them day by day we're always with them during their recovery period and making sure that they are completely comfortable with the plan so they have the best results possible. Usually by 1 week, patients are able to resume work. Now, work meaning 9 to 5 administrative work is ideal. If somebody is doing heavy lifting at their job, I'd probably advise them to maybe take another week off, but generally able to go back to work in 1 week. And by 2 weeks, you should be able to see family and friends and do most things by 2 weeks. Patients like to ask, when can I color my hair? 2 weeks. When can I wear my contact lenses? 2 weeks. Makeup, 2 weeks. Dancing, exercise, 2 weeks. So who is a great candidate for my signature Bella Lift? Generally, it's patients that have low set brows, patients that have excess upper lid skin and perhaps some fat near their nose, the nasal fat pockets, patients that have prominent fat pockets in their lower lids along with some hollowing and some skin texture changes. These patients will do fantastic with an endoscopic brow lift, upper lid blepharoplasty, and lower lid blepharoplasty with fat repositioning, usually with a CO2 laser, chemical peel, or microneedling to the lower lids. The Bella Lift is a game changer in my practice. It's a game changer when it comes to aesthetic surgery, especially in the upper face, and it's a procedure that's something that I have an incredible passion for and that I absolutely love performing it and seeing the results that my patients have during their process. And if you're somebody that's considering having a Bella Lift, this is somebody that's really been looking at and noticing changes around the brows, upper and lower lids, please reach out. Happy to meet with you, and then we can set up a time to meet either virtually or in person to see what best plan of action would be ideal for your situation. Hopefully you found this video helpful. Please subscribe if you haven't already, and I'll keep you in touch with more and more videos in the future.